Dengue fever, an illness that's on the rise in tropical and subtropical regions around the world. But how much do we really know about it? Can we recognize the symptoms early enough? And what can we do to protect ourselves? In today's video, we're breaking down everything you need to know about dengue fever, from its causes to how you can spot the symptoms and stay safe. So, let's get started. Hey everyone! Welcome back to the channel. If you're new here, I'm your name, and on this channel, we talk all things health, giving you the knowledge to stay informed and make better decisions for your well-being. Today, we're diving into something that might sound scary, but with the right information, you can be prepared: dengue fever. So, what is dengue fever? It's a viral illness transmitted by mosquitoes, specifically the Aedes mosquitoes, which are most active during the day. These mosquitoes pick up the virus when they bite someone who's already infected, and then pass it on to others through their bites. Now, here's the kicker: dengue fever doesn't just cause mild discomfort. In fact, it can lead to some pretty severe symptoms, and in some cases, even be life-threatening. But don't panic just yet. Let's talk about how you can identify it, and more importantly, how to prevent it. Dengue fever symptoms usually show up 4 to 10 days after a mosquito bite. And while the virus doesn't always cause severe illness, it's important to know what to look for. Let's break down the classic symptoms of dengue fever. Here's what you might feel if you have dengue fever. First off, a sudden high fever, often reaching up to 104 degrees Fahrenheit or 40 degrees Celsius. It's not like a regular fever. It comes on quickly and can make you feel pretty miserable. Next, a severe headache. This isn't your run-of-the-mill headache. The pain is deep and feels like it's pressing against your forehead. Along with that, you may also experience pain behind the eyes. This aching feeling can make it difficult to even look around or move your eyes without discomfort. Then, there's the dreaded joint and muscle pain. This is often why it's called breakbone fever. The pain can be so intense that it might feel like your bones are actually breaking. As the fever progresses, many people develop a rash that starts on the chest or back and can spread to other parts of the body. Skin becomes incredibly sensitive as well. Finally, nausea and vomiting are common. You might lose your appetite and feel very weak, which can make recovery even harder. Now, while dengue fever often resolves in about a week, there's a dangerous side to the virus. In some cases, the disease can progress to more severe forms, like dengue hemorrhagic fever or dengue shock syndrome, both of which can be life-threatening. So, it's really important to know the warning signs. If you or someone you know experiences any of these, it's critical to seek immediate medical help. Intense abdominal pain, which may feel sharp or constant. Bleeding from the nose, gums, or in the stool can indicate that the disease is getting serious. Vomiting that won't stop and prevents you from staying hydrated. If you're struggling to breathe or your breathing becomes rapid and shallow, this could be a sign of shock. Extreme fatigue or restlessness, which might signal the body is in distress. Now, before you start feeling overwhelmed, let me reassure you, there are preventive measures you can take to lower your risk of getting dengue fever. Here's what you can do to protect yourself from dengue fever. Mosquito repellents containing DEET, picaridin, or oil of lemon eucalyptus can help keep mosquitoes away. Apply it to exposed skin when you're outside, especially during peak mosquito activity times, dawn and dusk. Wear long sleeves and pants when possible, especially in areas with high mosquito activity. You can also treat your clothes with permethrin for added protection. Mosquitoes breed in stagnant water, so make sure to eliminate any standing water around your home, things like flower pots, tires, or clogged gutters. If you have a water storage container, make sure it's sealed tightly. If you're staying in an area where dengue is common, sleep under a mosquito net, especially if you're in a place with no air conditioning or proper window screens. Finally, stay updated on dengue outbreaks in your area, especially if you're traveling to tropical or subtropical regions. Alright, there you have it. Dengue fever may sound alarming, but with the right knowledge and preventive steps, you can protect yourself and your loved ones. If you're ever in doubt about your symptoms or those of someone else, remember, early medical attention is crucial. Thanks for watching today's video.